Infections don't spread by accident. They follow a predictable pattern called the chain of infection. In this video, we'll walk through each link in that chain and show how your actions can stop infections before they start. Think of infection as a chain with 6 links. For an infection to spread, every link has to be in place. If we break just one link, we stop the infection from moving on to the next person. Link 1 is the infectious agent, the germ itself. This could be bacteria like MRSA, viruses like influenza or COVID-19, or fungi like Candida. Without a germ, there is no infection. Our goal is to keep these agents from spreading or multiplying. In everyday healthcare, these germs show up in common situations, like a patient coughing in the waiting room, a contaminated tissue, or germs living on the skin. Recognizing that germs are always present helps us stay alert to infection risks. Link 2 is the reservoir, the place where germs live and grow. This might be a person's body, a contaminated surface like an exam table, or equipment such as stethoscopes or blood pressure cuffs. Anywhere germs can survive, that's a reservoir. In healthcare, our most common reservoirs are people, frequently touched surfaces, and shared equipment. Routine cleaning, disinfection, and proper handling turn these from dangerous reservoirs into safer spaces. Link 3 is the portal of exit, how germs leave the reservoir. This can be through a cough, a sneeze, blood from a needle stick, sweat, vomit, or other body fluids. If germs can't get out, they can't move on to the next host. In practice, we see portals of exit every day. A patient coughing without a mask, sweat, or other fluids during a procedure, or blood during a blood draw. Each of these is a chance for germs to escape. Link 4 is the mode of transmission, how germs travel from one place to another. The main routes we worry about are our hands, the air, and droplets from coughs and sneezes. This is where your routine habits make a huge difference. Germs can move by touch, like contaminated hands opening a door. They can move through the air on tiny droplets and particles when we talk, cough, or sneeze. Breaking this link is all about hand hygiene, clean environments, and respiratory etiquette. Link 5 is the portal of entry, how germs get into a new person. Common entry points include the mouth, nose, eyes, and any break in the skin, such as a cut for sight or surgical wound. When we touch our face with contaminated hands, adjust a mask incorrectly, or handle a wound without proper protection, we give germs a way in. Protecting these entry points is essential to keeping patients and ourselves safe. Link 6 is the susceptible host, the person who becomes infected. Some people are more vulnerable than others, including older adults, very young children, people with chronic illnesses, or anyone with a weakened immune system. In healthcare, we care for many high-risk patients, those undergoing surgery, on chemotherapy, with chronic diseases, or with invasive devices like catheters and forelines. Our infection control practices help protect them when they are most vulnerable. So how do we break this chain? At the infectious agent and reservoir links, we use cleaning, disinfection, sterilization, and sometimes medications to reduce or eliminate germs where they live. Routine environmental cleaning and proper equipment processing are critical steps. At the portals of exit and entry, and in modes of transmission, we rely on hand hygiene, masks, gloves, gowns, and respiratory etiquette, like covering coughs and sneezes. These are our everyday tools to stop germs from leaving one person and entering another. At the susceptible host link, we protect people through immunizations, safe care practices, and close attention to infection control protocols. By following guidelines and staying up to date on your own vaccines, you help strengthen this final line of defense. Every shift, you have multiple chances to break the chain of infection by washing or sanitizing your hands, using the right personal protective equipment, cleaning high-touch surfaces, and following standard and transmission-based precautions correctly. Infections only spread when the entire chain is intact. Your choices, moment by moment, break that chain. Clean hands, clean conscience. When in doubt, wash your hands and use the right PPE. Your actions protect your patients, your coworkers, and yourself.